we have a 44-year-old man with a history of HIV that presents with a 2-week history of progressively worsening headaches, facial weakness, and visual hallucinations, and new onset eye pain. And the MRI of the head is shown as here. What is the most likely causative organism? Is it A, CMV? Is it B, Streptococcus? C, Toxoplasma? Is it D, HSV? Or is it E, Pneumocystis jirovecii? Is it A, CMV, B, Streptococcus, C, Toxoplasma, D, HSV, or E, Pneumocystis? Now, this is a 44-year-old man with a background history of HIV. This is very important because you need to know all the risk factors for HIV and also the complications as well of diseases. And this is why this highlights that. And HIV is one of the most common ones here. So you've got a 2-week history of progressively worsening headaches, facial weakness, visual hallucinations, and new onset eye pain. And you can see it in the MRI here on the right side. So I'm going to give you 5 more seconds for you to have a think about what could be the correct answer. The correct answer is C, Toxoplasma. Now, Toxoplasma is a very important organism to consider in any differential diagnosis of CNS lesions in anyone with a background of HIV. So Toxoplasma is a protozoan parasite that can cause latent infections which can reactivate when the immune system is compromised, such as untreated AIDS. And often it is important to recognize the Toxoplasma encephalitis because it is important to recognize it and because it's going to change management. Okay, so whilst Toxoplasma is the correct answer, you got to have a think which other conditions can also present something like this. Now, could it be primary CNS lymphoma? So AIDS-related primary CNS lymphoma can present with this neurological symptom and ring-enhancing lesions on the MRI. So on the MRI, we can see on the right side, it's very crystal clear. It looks like a signet ring, didn't it? It looks like a ring. So that's what's called ring-enhancing lesion. And certainly with CNS lymphoma, you do get that as well. But with the CNS lesions that you get with a CNS lymphoma, you tend to get it in the sense that it is near the periventricular region. Okay. Now, what about cryptococcal meningococcal encephalitis? Well, Cryptococcus neoformans can cause meningitis and encephalitis in those with HIV, but often the MRI findings show pseudocysts rather than ring-enhancing lesions, so that's why it's not it. Now, progressive multifocal leukoencephalopathy, PML, which is caused by the JC virus, can occur in advanced HIV infection. It often results in non-enhancing white matter lesions on MRI rather than ring-enhancing lesions. And obviously, when someone's or ring-enhanced lesions, we see the enhancement, which is denoted in very light color in the shape of a signet ring. Now, could it be something like TB? So in places where there's a lot of high tuberculosis burden or prevalence, then CNS tuberculomas can be considered, but tuberculomas are often fewer in number and have a more nodular appearance than something like this. So what about Pneumocystis jirovecii? What about that in terms of option E? Well, pneumocystis is a very common opportunistic pathogen in HIV-infected patients that causes PCP, pneumocystis pneumonia, but that causes lung issues, namely that of oxygen desaturation rather than ring-enhancing lesions in the CNS. Now, a lot of people might say, oh, could it be something like HSV, option D? And that you're right, it does cause acute encephalitis, but often involves temporal lobe enhancement on the MRI, very much localized rather than ring-enhancing lesion that we can see here in itself in this particular MRI. Now, it's not going to be CMV because CMV can cause eye problems, most commonly retinitis, encephalitis or myelitis. And so it's not going to be a cause of this, and it's unlikely to be streptococcus, which can obviously lead to bacterial meningitis and formation of brain abscess. Now, with brain abscess, they tend to be much more robust and rather than ring enhancing lesions, which are more typical of Toxoplasma. much.